I'm David Gottenborg, a chiropractor in Pelican Rapids, and today what I wanted to talk about was what is the connection between the lower neck, upper back, and perhaps shoulder pain on the same side. So in our discussion today, when I talk about shoulder pain, I'm going to describe pain either in the front, the back, or probably one of the most common areas would be the right upper arm. The other thing to understand is that when the joint moves correctly, this long bone in the upper arm moves beneath another bone, involving some 26 different muscles, 3 or 4 different joints, all while trying to prevent impingement of either a tendon or tendons, the bursa, or the joint itself. One of the most important findings or classic signs of impingement, or for that part, arthritis in the shoulder, would be limited range of motion. I think the other symptom would be night pain, particularly the right upper arm. The referred pain from the shoulder, in most instances, causes right upper arm pain. Coincidentally, this is also the area that can be affected by a problem in the lower neck or upper back. What we're going to do here is we're going to look at a couple different examples of an x-ray. One that shows a more normal looking shoulder, and you'll notice just at the very top of the long bone of the arm there is a space about 5 millimeters, so just a little bit more than 1/4 of an inch, that sits right below the acromion. In the second example, you'll see as this person begins to elevate their arm, the top of the long bone of the arm is contacting the acromion. This is what we call impingement. This will cause pain. This will limit your ability to elevate your arm. And what's it pinching? It's pinching a bursa. There are 3 tendons, and it may irritate the joint itself. Interesting enough, 2 of the tendons are very, very important muscles within the shoulder, or tendons within the shoulder, the rotator cuff tendons. What are some of the causes? Now, the easiest causes would be overuse or using your arms repetitively. Another cause may be falling with the arm outstretched. But I think most people end up here because over time they've developed poor posture. This type of posture, the rounding of the upper back, changes the movement in the shoulder. Therefore, there's friction, ultimately there's pain. So why are chiropractors qualified? Chiropractors are qualified because we can do some of the same things the physical therapists are doing as far as controlling pain, restoring range of motion, and improving function or strength. But more importantly, we consider all the joints that are involved with shoulder movement. The sternoclavicular, the acromioclavicular, the shoulder joint itself. How does the shoulder blade move in respect to movement? And then the neck and upper back. And all of these movements that I've just described, each one of these joints, chiropractors are trained specifically how to improve the function and motion in any one of those joints. So that being said, I think that chiropractors are well qualified to not only assess and evaluate a shoulder or your shoulder condition, but provide the right type of treatment that's comprehensive, that not only restores function but strength. If you have any questions, please contact our office and we'll be happy to help you.
Thank you for watching Wellness for Life.